I often get asked with our bariatric patients, do I have to be on these extra medications forever? How do you approach that question when people come and chat to you about that?
The people who've had any type of weight loss surgery really have to be on appropriate supplementation, so that's usually vitamins and minerals, and monitoring lifelong. And the way I approach it is I tell people what the surgery has done to their absorption of these things. So all of our surgeries reduce intake, but also more importantly, they change the function of your stomach. When you've had a sleeve or a bypass, you are no longer mixing your food with acid. If you don't mix food with acid, you will miss out on absorbing some minerals and some vitamins. And we know from studies that in the absence of appropriate supplementation, even with a sleeve gastrectomy, there's insufficiency in B vitamins in people's systems, and at least in 20% of patients early after surgery. And after gastric bypasses in particular, insufficient supplementation will lead to likely neurological and nerve injuries in about 20% of patients. So it means that most people might get away without doing it, but the ones who don't get away with it,
it's disastrous,
it can be disastrous for them. And really, the cost of a multivitamin every day is very small on a financial basis, and also from a commitment. It's not a big commitment. A lot of us, as we get older, end up on regular medications anyway. And a supplement is an insurance policy for you to have against future problems.
I think one of the things I've found with our patients is that they assume that because they're putting healthy stuff in the top end, that it'll be okay. So it's one of those over and over again kind of conversations, because people just find that concept. And I find it's helpful for them to remember that they've had a plumbing change. And that's the way I put it. You know, you don't have a normal stomach. It's not like your mother who's having the same food, or your sister. You are not going to absorb the same things. And I think the thing is too, and this is helpful for patients, is they can feel relatively well for a while on these things, because some of these nutrients take a while to come out of your system. And so, if we had a little flag that popped up when you become deficient, we could afford to be a bit more hit and miss. But the problem is, by the time the problems come, we don't have any symptoms necessarily until they're there. And that's the thing they need to understand as well, because otherwise they assume they're fine. They don't realise that these things are dropping down. I mean, they'll get tired and they all know about iron deficiency, but they don't know about all the other things. And I think that's interesting.